Alrighty, welcome back to Pivotal Discourse. I'm your host, Jeff Hartney, and I'm sitting down with Victoria Montero, Executive Director of Hispanic Center Lehigh Valley. How are you, Victoria?
I am good, Jeff. How are you?
I'm wonderful. Thanks so much for being on the show.
I'm excited to be here. Thank you for the invitation.
Excellent. So can you fill us in a little bit about your background?
Sure. I was born and raised in Mexico. And at the age of 14, my parents decided to move to the United States, and that's how we arrived in the Lehigh Valley. I went to Bracco Middle School, I went to Liberty High School, and then went on to Northampton Community College. At that point, I wanted to be a social worker. I wanted to be a teacher. I wanted to do something giving back to the community. Eventually, like many other college students, I figured it out. And I decided to pursue a bachelor's in healthcare administration, focused on public health, and then a master's of public health. During that period, when I was 17 years old, I started to work at St. Luke's after school. And since then, I've been employed by St. Luke's University Health Network in the community health department.
Oh, wow. So backtrack just a little bit. So you left Mexico at 14. Mm-hmm. What brought the family here to the Lehigh Valley?
So at that point, my dad really wanted us to have a better quality of life, especially when it came to education. There were limited opportunities in the area that we were living in Mexico at that time period. And also, we had been approved to become USA residents, so we were excited to come to the U.S. My dad had siblings here in the Lehigh Valley that were already formally established. They had homes, they had jobs, and this was a good opportunity to move here to be close with the family and get ourselves settled as well here in the Lehigh Valley.
Okay. And you said you were working with St. Luke's even in high school?
Yes.
How did that work? Is there like some type of like work
It all
program,
started when I was in 10th grade. I participated in a program called the School to Work program, which is a collaboration between the Bethlehem School District and St. Luke's Hospital, where students in the ESL program have the opportunity to come to the hospital and rotate different units. And the idea is to expose students that are coming from very diverse backgrounds into the world of healthcare. When that program was completed, I applied through a summer program at St. Luke's, and that's how I got my experience started here.
Okay. Now, I heard the school program is in their 25th year?
Correct.
Excellent.
Mm-hmm.
And you're in charge of that program?
I am. So, what a circle of life. I came in that program, and now I get to actually manage it.
Oh, that's incredible.
That is.
That's got to feel pretty good.
It is, because I now get to see the other side and be the one, putting the implementation plan for those programs and supporting many students that we serve over the years.
Okay. So you've been with St. Luke's for quite a while now. What exactly do you do for them?
So right now I have two roles. One role at St. Luke's is the Manager Health Equity Initiatives, where I oversee career mentoring programs for high school students. That's observational and work experience. The observational is bringing students like School to Work and other programs from the local school districts into the hospital setting, where the students get to see the different career ladders that we have. In the work experience program, we partner with the Lehigh Valley Workforce Development Board, and students come in and they actually get to work in the hospital in the summer or after school. Oh, wow. None of these students are placed in the kitchen or environmental services, because we want to inspire youth to believe they can achieve, a career ladder in St. Luke's. There's nothing wrong with working in those roles, but, minorities tend to stay in those roles. And most of the students that we serve come from very diverse backgrounds. We want to inspire them to be the doctor, to be the next nurse, to be the next financial analyst. We want to see, help them pursue that career, and they're able to stay with our network, which is even greater for us.
Excellent. So not only do you work in community health for St. Luke's, mm-hmm. but you're also the executive director of the Hispanic Center of the Lehigh Valley. Talk to me a little bit about the Hispanic Center.
So the Hispanic Center Lehigh Valley is a nonprofit located on the south side of Bethlehem. It opened its doors in 1968 by the Puerto Rican community. A group of community leaders raised $750 to open up what is the Hispanic Center Lehigh Valley. The focus of this agency is to improve the social capital of community members, focusing primarily on the Latino community supporting the community to become self-sufficient.
Okay. Talk to me about the word self-sufficient. I know that's in your mission statement. What does self-sufficiency mean to you?
Self-sufficient has different definitions. In my work at St. Luke's has the definition of supporting youth to know what is job keeping and then job seeking skills. Because what I often see students graduating from high school, they don't even have the skills to get a job. And if you can't get a job, you're not going to be self-sufficient. In my role at the Hispanic Center, I see in many different ways. For instance, in the social service program, that's the program that provides community connections and referrals to connect the community for different services. We often have people come in and ask, I need help to get a license. And a license is not just an ID. It's now, if you have that ID, you are able to apply for medical assistance. You're able to apply for food stamps. You're able to apply, for a job. That's what's self-sufficient.
And you need all that. But you need a driver's license in order to get
Correct.
that, or at least an ID.
Yep.
Okay. Excellent. And the Hispanic Center does all of that.
Yes.
What other programs does the Hispanic Center have?
So the Hispanic Center manages a senior center program. We are funded primarily by Northampton County, the United Way, and other private donations. And what this program does, we provide culturally linguistic services to seniors in Northampton County. These are all seniors that are Spanish speaking. We have a breakfast and a lunch, so we provide meals in the facility. Everything is cooked in-house, and everything is culturally appropriate with the Hispanic seasoning. You walk into the Hispanic Center, and you're going to smell the Hispanic seasonings, and you smell that kitchen. Everybody always wants to jump in the kitchen and eat something. We also do recreational activities. We do a walk with the doctor, which is doctor from St. Luke's goes to the Hispanic Center, and they'll do a walk in the Greenway with the seniors. We do Zumba classes. We do many recreational activities. Today, actually, our seniors went up to Lehigh University to see a concert.
Excellent. Now, is there an age limit for the senior program?
So we, prior to COVID, we were serving about 100 seniors unduplicated. Now we are only serving 55. We're in the process of increasing the number, and the age is not restricted. Is we have a grant funded recommended age of when they start in the program, which is 65 and up.
Excellent. So besides the seniors, what other programs do you have there?
We have a food pantry. The food pantry started about 10 years ago at the Hispanic Center, addressing the food insecure in the south side of Bethlehem. The south side is designated as a food desert, meaning there is not a lot of grocery stores for our community to shop and to buy fruits and vegetables. You'll see a lot on the south side what we call in Spanish bodegas, which are the mini grocery stores in the corner. Typically, those little grocery stores are very expensive, and our community can't afford the food there. So as a response, the Hispanic Center opened up the food pantry. The food pantry typically on a fiscal year prior to COVID was serving about 800 people.
Oh, wow.
Now we're serving close to 3,000 people in a fiscal year.
Whoa.
What we do with the families, they come in and they get a culturally appropriate package. We're able to provide them canned food, but we don't want to give canned food. We want to ensure that we're giving them that shopping experience as if they're going through a grocery store.
Oh, okay.
So through other community partners, we're able to give fruits and vegetables. We're able to give meats. We're able to give dairy. And we're also incorporating some of the Hispanic seasonings. So when they take that chicken at home, they're able to, add that flavor from their culture. So we minimize food waste.
Prepare it the way they like it. Mm-hmm. That's amazing. Wow. Now, does anyone in the city of Bethlehem have access to the food pantry, or is there limitations to it? How does it work?
So our pantry is primarily funded by Second Harvest. They're our main source of support to the pantry, along with many other community partners. And they have to live in Northampton County, and they have to meet the income eligibility set by Second Harvest.
How does a person find out if they're eligible or not?
We do a lot of grassroots efforts, distributing flyers out in the community, getting out information out to the schools, Second Harvest website, the Hispanic Center website, our Facebook page. We try to find creative ways. When you work with, in this type of work, you really have to get connected to the community at a grassroots level. And that's the key to be able to get the message across. We often have great programs, but if we don't have a strategy to deliver that program to the community, then our programs won't be successful.
And what are the hours of operation? Is it open every day? Are we talking every other day?
Actually, the food pantry is open Monday through Friday.
Wow.
Most of our appointments come on Monday through Thursday, and on Friday is our pickup day for all the donations. On Fridays, we receive about 2,000 pounds of food from Second Harvest.
Now, the food pantry...
from Sam's Club.
The food pantry wasn't always open every day, was it?
No.
I didn't think so.
So prior to COVID, it was once a month.
Yeah.
So what we do now, we are blocking every 30-minute an appointment. That way, the client can walk through the pantry and make that food selection, and we give that individualized experience. So they're not interacting with the client that is coming after them. They have that experience by themselves. Oftentimes, when you're facing food insecurity, people feel ashamed. People feel uncomfortable. We want to customize this experience very client-driven and make the client as comfortable as possible, that they feel comfortable making that selection and comfortable with what they're taking home as well.
Wow. Now, do you have any limitations? Like, can people only visit once a week, or how does that work?
So right now, we're in the process of serving our families only once a month because that's based on the funding restrictions. But if other donations come through and families request, then we'll connect them to other resources as well.
Wow, that's just incredible.
A lot of work.
I'm sure. But think about all the people that you're helping.
And the COVID experience, brought so much need than ever before. When everything hit the pandemic, we had families coming in, single moms that now they had all their kids at home. They had no job. They couldn't go out to work. And that was the only way to get food through the food pantry. So we had a lot of those people calling the Hispanic Center. How can I access food? How can I schedule an appointment? And lucky with the support of many community partners, we were able to remain open the entire pandemic.
Wow. Okay, so we've got the senior program. We've got our food pantry. What else do we have?
The social service program.
Okay. Talk to me a little bit about that.
The social service program is the program that connects the community to connections and referrals. So, for example, we may have a senior that came in last week to the Hispanic Center, and he is 85 years old. His only source of income is Social Security. He doesn't speak English. And now he needed to complete a form to submit to Social Security to get his monthly payment. He didn't understand the form. Now he doesn't have a payment for this month, and he doesn't have any money for rent. So the Hispanic Center support that senior by first understanding what is the issue, calling Social Security and making that correction on the form. And through a community grant that we call a Health Equity Fund, we were able to support that senior with $300 to pay that rent for that month. But now next month, he's going to get his check and he's going to be paying that rent on his own. Wow. So just helping people, it's not about giving, it's about getting people to the next step in their life and providing that support that they need here. One of the issues that we're seeing the most in that program is the housing crisis. There is a major housing crisis in the Lehigh Valley, and we're seeing more in communities of color that are being affected on the south side of Bethlehem. An apartment on the south side, a single room is now $700-800. When the community is making $24,000 a year, they can no longer afford that.
Sure.
So we have a lot of people coming in. They often don't know how to call the bank. They don't speak English. They need a letter to be drafted. They need a letter to be translated. So we're making those phone calls, connecting with landlords, connecting community partners, getting people out to New Bethany Ministries because they have the housing support. So even completing the application at the Hispanic Center for the housing service at New Bethany. So especially they're Spanish speaking, we want to get as much as we can when it comes to the paperwork process and help them at the Hispanic Center. Because what we often find is that with the Hispanic community, it's all about trust. They may trust the Hispanic Center. Now they're able to provide all the information they need for that package that needs to go to New Bethany. So by the time that they go to New Bethany, they hopefully have everything ready to submit their application through there.
I see. So you've got a lot of good programs here. How does St. Luke's tie into all this?
St. Luke's is a partner that is extremely invested at the Hispanic Center Lehigh Valley. Everything started about 5 years ago. The Hispanic Center was going through a renovation. At that point, the previous leadership of the Hispanic Center asked Rick Anderson, the CEO of St. Luke's Hospital, to be the chair of the capital campaign to raise funds to renovate the Fowler Community Wellness Center. Mm-hmm. This was a building that was donated to the Hispanic Center by Lenny Fowler, who was a philanthropist here in the Lehigh Valley and supported many nonprofits. The building was donated to the Hispanic Center, but we were having a lot of operational issues. The building was used as a boxing club, a mentoring program site, renting apartments on the second floor, but nothing was working.
It was a bank before that,
It was
right?
a bank before that. Mm-hmm. And Rick Anderson joined the Hispanic Center in this capital campaign, and through his leadership, we were able to raise $2.4 million to renovate not just that facility, but the other facility at the Hispanic Center as well.
The Basilio Huerta Senior Center.
Correct.
Excellent.
So now our facilities, we have, outstanding facilities to offer our community the best service are possible. And that's what the St. Luke's, they always work with the Hispanic Center, but that partnership became stronger through that relationship. And since then, St. Luke's has continued to provide a lot of capacity building to support the Hispanic Center.
Wow, that's incredible. Now, here's a weird question. Must someone be Hispanic or Latino to use the services at the Hispanic Center?
Nope, that's a question that we often get on the phones. Do I have to speak Spanish speaking to come here? No, we serve everyone regardless of race, color, ethnicity. And that's what we're really working on, trying to change the narrative in the community. People in our building, we have a career link office, so we want people that are non-Spanish speaking to also access those services as well.
Oh, wow. So you offer job location and all that good stuff?
Correct.
Wow. What an amazing place.
We are one-stop shop.
It sounds like it. So if folks wanted to get involved somehow, like let's say people wanted to donate their time with the food pantry, how does one do that?
So there's many opportunities to get involved at the Hispanic Center. People can come in and volunteer in one of our programs. That could be in the food pantry as an individual, or you can also come in as a corporate. We had volunteers last week from St. Luke's that were there painting our food pantry. They were also restocking the shelves. So there's
Dr. Claris was just there.
Dr. Claris was just there.
Yeah, excellent.
There's also an opportunity to come in, and if you want to be a corporate partner and make a donation to support the operation of the program or a specific program. Commitment doesn't sometimes have to be money or resources. It can be capacity building. In the corporate world, there's many different skills, and nonprofits, that's an area that we lack. And we're always looking for partnerships that we can strengthen our capacity building internally. So a corporate partner wants to come in and provide that support. It is greatly appreciated.
Excellent. And Hispanic Center has their annual fundraiser coming up, correct?
Correct.
How does somebody get involved with that?
So it's going to be at Lehigh University. We are going to be focusing on highlighting Cuba. So it's going to be a Cuban night. We're going to have a Cuban menu, the music. It's a fun Hispanic party.
Excellent.
And if anybody wants to be involved, they could be a sponsor. There's different levels of sponsorship. There's also opportunities to make a donation to the silent auction. There's an opportunity to volunteer. So, if anybody wants to volunteer, please let me know. We need a lot of support and hopefully make it a very successful fundraising event.
And they can just reach out to you through the site?
Yep.
And what is that?
www.hclv.org.
Let's talk about self-sufficiency a little bit more. Do you have any other examples? I know you mentioned the ID. What other examples of self-sufficiency is the Hispanic Center doing for their clients?
Another example is families coming in when they newly relocated to the Lehigh Valley. They don't have anything. They don't have a connection to a school. They don't have health insurance. So when they come into the Hispanic Center, we'll help them fill an application for medical services, connect them to a healthcare network so they can have that medical services, connect them to food stamps. And when there is a fire in the community, they often come into the Hispanic Center and they're in need of furniture because they basically starting their whole life all over again. So we work with different community partners and getting furniture that then we can get that family reestablished. Oftentimes we have people that come in and they don't even have a pair of shoes. So getting them a new pair of shoes. We work with many community partners where they donate. So for example, Amazon is one of those partners. A lot of those items that get returned to Amazon have now here in the Lehigh Valley, they have been donated to the Hispanic Center. And for Christmas, we were able to give our seniors something that was brand new. And as one of them was a juicer. Our senior called our coordinator crying that she couldn't believe that she got a juicer for Christmas. Think about that. It's something that is worth less than $50. But to that senior, that meant the world. That's the most expensive gift she ever gotten for Christmas. And now she's able to make her juice that she's always dreamed of through a donation that we got through Amazon, and we were able to give it to her.
Wow. So we're not just talking about handouts here, though. We're talking about things that will help your clients stand on their own 2 feet, correct?
Correct. Mm-hmm.
That's amazing. So take me through a typical day at Hispanic Center. What does that look like?
Well, when you open up the door, you're going to smell the smell of that kitchen, and they're getting the breakfast ready for the seniors.
Now, do you provide breakfast, lunch, and dinner, or just?
We provide breakfast and lunch.
Okay.
They come in, they're checking their temperature. They all get seated in the designated areas. Our food pantry is getting ready to prepare the food packages for the day. What is the schedule for the day and the number of appointments? Our social service program has a schedule for the same of appointments all day, to meet one-on-one with our clients. And the wake off is the same as well. We have moms coming in for nutrition education and also for the benefit pickup, so they can then go to the grocery store and get their cart loaded with benefits, so then they can get the milk for their babies.
Well, I don't think we even touched on that. So you have a WIC office there?
We
too?
do.
Interesting. And what do they do there?
So the WIC office is funded through Maternal Family Health Services. And what we do at the Hispanic Center, we provide nutrition education from the time of pregnancy up to the age of 5 of the child. The moms come into the Hispanic Center and they meet with the nutritionist and they get nutritional education. And then they get the benefits that they can go to the grocery store and pick up based on the eligibility of WIC.
Wow.
We serve in that program typically about 10,000 appointments in a fiscal year.
That is unbelievable.
Very busy.
Wow. So, speaking of busy, we had touched on this briefly. You have seen your client base kind of increase because of COVID. Do you see that slowing down, or do you think because of COVID, people have realized all the services that HCLV can provide and you're only going to grow from here?
I think we're going to grow from here. Now that things are a little bit more stable on the community work, restrictions with COVID have been lifted, we see more community members seeking service for the food pantry. We are going to be ending this fiscal year serving almost 3,000 again. In the social service program, we have more appointments than the availability that we have in our program. Due to the housing crisis, we have community members calling every day and inquiring about how can they get an appointment and get connected to community resources. We saw, we always knew there were disparities in our community and there were a lot of racial justice issues, but COVID brought everything to light completely. And now we're seeing a lot of mental health issues in our community as well. So I am seeing, and many nonprofits are seeing a demand on our services more than ever before.
Wow, that's just amazing. So with regards to COVID, I would imagine just like every other organization, you had your challenges throughout COVID. Can you touch on some of those?
One of the major challenges was, while everything was closing, we had to remain open. And more people were seeking our services. So we had to be very creative on how do we continue to deliver uninterrupted services to clients. And one of them was the Senior Center program. The Senior Center that come to the Hispanic Center rely on many resources that get provided through that Senior Center. We had to close our doors. So we had to then take a different approach. How do we get food to them? How do we get them the vaccine? How do we get them resources they needed? And we were able to deliver about 20,000 pounds of food to the seniors during the COVID-19 pandemic.
Wow.
We were able to provide virtual phone calls, text messages, case management services, and ensure that every single one of them was fully connected and was fully vaccinated when the vaccine became available. And continue to provide many resources. There were many times that our vehicle that we utilized during the pandemic that we own at the Hispanic Center broke down. So we had to come up with a different strategy and ensure that we delivered those food packages. The food pantry, like as I mentioned before, we went from serving 800 to almost 3,000 people in a year, distributing almost 70,000 pounds of food in a single fiscal year.
Now, how did you do that with the challenges of COVID? It's not like you had the center open, so how did you get food to the people that needed it?
So the major challenge, because the limitation of volunteers, everybody had to step in from every single level. Our board members, there were a few community members that were coming in to volunteer, but we had more needs than we had staff to support it. So that was definitely one of the biggest challenges, being able to, because running a food pantry is like running a grocery store. There's a lot that goes on the back to be able to make that work. And when you have limited staff, to be able to distribute 70,000 pounds in a year, that was a lot of work and a lot of, heavy lifting from all different levels of the organization.
Wow. Just this place sounds incredible.
It's fun to work there. It's very rewarding. I have a lot of fun. The staff have a lot of fun. And the best experience, we get to interact with amazing community members that are extremely appreciative of the work that we get to do every day with them.
So you had mentioned, obviously, the COVID vaccine. Mm-hmm. You guys did a couple of clinics, did you not?
We did. We did a lot of clinics. So everything started, there was a lot of mistrust in the vaccine in communities of color. And we started partnering with St. Luke's Hospital to run clinics at the Hispanic Center, where we vaccinated. We started with 400 community members, and then we partnered with Capital Blue, and we vaccinated 1,000 community members. We got people calling from Reading, from Philadelphia, from Lancaster, driving all the way to the Lehigh Valley, and they heard over the radio that the Hispanic Center was getting the vaccine out to the Latino community, and they were coming to get vaccinated here.
Wow.
From there, we realized how much the community trusted the Hispanic Center when it came to messaging about the COVID-19 vaccine. So we applied for a grant from the CDC Foundation. The CDC Foundation released a request for proposal, and only 150 nonprofits across the country were awarded, and we were one of them.
No kidding.
This is our first national grant, so this was a big deal and exciting news for the Hispanic Center. So we were very excited. Through this grant, we have managed about 22 clinics in the community, working with community partners. We go right in the neighborhood. We are going to housing projects, grocery stores, clinics at the Hispanic Center, in Allentown, in Easton, in school districts, just finding creative ways on how do we get the vaccine right in the neighborhood instead of expecting the community to come to us.
Okay.
We also have done a social media campaign where local influential Hispanic messengers were part of the videos and, continue to push the positive message. And one of the very successful strategies is going on the radio and spending about 10 minutes. And Dr. Claros was one of those influential messengers. We would work with Dr. Claros, and we would select a topic of very relevant at that moment with COVID. And he would spend about 10 minutes on the radio at La Mega radio station, where he would disseminate very complex COVID-19 information in a very simplified way. And from there, we would get a lot of phone calls at the Hispanic Center inquiring, how can I get the vaccine? Because with a media like that, you're able to reach 30 to 40,000 people, in those 10 minutes during the morning.
Sure. Now, was it just like a trust issue, or what was the disconnect there?
A lot of misinformation. What you and I read, what our community read from the CDC, that's not what gets to our community. They're seeing what's on Facebook, what's on TikTok, what's on social media that is not reliable, what's the message from the community, from their neighbors. And unfortunately, most of this time, it's not reliable information. And that's where our job comes in.
I see. So besides COVID, are there any other healthcare clinics that HCLV is in charge of?
So co-located within the Hispanic Center, St. Luke's Hospital manages an HIV clinic that provides medical and prevention services. We refer clients there at the Hispanic Center, but we are not managing the clinic directly.
Okay. And how are you getting this information out there? How does the community know that these types of clinics exist?
The clinic at St. Luke's does a lot of grassroots level outreach, connecting with the local businesses. I know they do a lot of work out in the community, and that's how they get the word out in the community. And they have a lot of patients that have been with them for many, many years.
Now, the Hispanic Center has been involved in a health equity summit for the last couple of years. Can you touch on that a little bit?
Correct. So this became a fundraising strategy for the Hispanic Center. So every year what we do, the fundraising committee selects a topic of high interest. So for instance, the first year we focused on immigration. That was when President Trump was deporting children at the border. There was a separation of children from their parents, and there was a lot of conversations at a national level from immigration. So what we did, we got a panel of speakers together and from all levels of expertise to talk about the importance of immigration and looking at immigration as a strength, not as the weakness that is often looked at in the nation. The following year, we focused on Census 2020. Census is a very critical component for nonprofits. For every individual that does not complete the census, we could possibly lose about $2,300 per person for the next 10 years. That reduces the funding that nonprofits get from the local county, from the local government. So as a nonprofit, we wrote a panel of experts to talk to many individuals. We had about 100 people come to our summit live. The following year, we focused on racial justice and the colorism that we have within the Latino community. That's the racism that we have with one another. And last year, we focused on economic recovery. How do we recover from COVID-19? So every year, it's an equity summit focused on a topic of high interest at a nationwide, but it's also an opportunity for partners to make a donation to the Hispanic Center, but at the same time, an educational opportunity for everyone that joins our sessions.
And has a topic been picked for this year?
No, we're in the process of picking the topic for this fall. So
Okay.
We're going to be making the discussion very soon with our committee.
Excellent. So we spoke with your boss a couple of weeks ago, Dr. Rajika Reed, on health equity and the cycle of poverty. Can you tell me what the cycle of poverty means to you?
I can talk about my two roles. So at St. Luke's, through the mentoring programs, we provide the participants one-on-one career coaching, a lot of mentoring, and really focusing on building what we call the job seeking and the job keeping skills, and focusing on developing career ladders. So the participants that come into our network in these mentoring observational programs have the opportunity to build a career at St. Luke's overall to break that cycle of poverty. An example of that, we have students that are living in the housing projects, and that's all they know. They have crime around them. They are in a single parent household. They have no mentorship or support. When they come to our program, we want to make them feel like they are in the St. Luke's family. They get a uniform, they get bus passes, they get that coaching, they get that one-on-one support. And from day one, they get connected to several mentors that can help them to grow professionally at St. Luke's. That's how I got my own career started there. I lived on the south side of Bethlehem. Did I ever think I was going to work in healthcare? No. Did I ever think that I was going to be doing public health work? No. I wanted to be a social worker. I wanted to be a teacher. But through the mentorship and resources that I was able to receive at St. Luke's, I was able to become who I am today. And now through the work that I do with the mentoring programs, we get to do that work with many different students. We have served over the years close to 900 participants.
Wow. That's incredible. Mm-hmm. And do you have any super success stories?
There's many success stories. We have participants that came in and they participated in our program. They got hired after they completed the program as patient care assistants, and now they went to the school nursing at St. Luke's, and now they're working as a nurse. We have other participants that are working as top financial analysts for the company as well. We have individuals working in biomedical engineering, in the pharmacy department, and we have many others that are working in the community. They have their own business. They have a barbershop. They started their own, venture in the community through the different skills that they learned through our programs.
Amazing. So I say this to a lot of my guests. Speak to me as if I'm a 5-year-old. Mm-hmm. What is the cycle of poverty? If you could break it down into a definition, what does the cycle of poverty mean? I would define it as not having the opportunities to be successful.
And that is often, I could be a student that wants to be successful, but I don't have the support at home. I live in an environment where no one has ever gone to school. And that's where all I know my whole life. So through the work that we do as St. Luke's with the mentorship programs, we're trying to change that. That we're exposing you to mentors, we're exposing you to career ladders, and that you want to believe and you're able to achieve those professional career lows to break that cycle of poverty.
And is there anything else that you would like to say to the community right now that they may not know about Hispanic Center?
Lastly, get involved. Working in the nonprofit sector is a very rewarding experience. It doesn't have to be a commitment of hours. Sometimes people get intimidated and say, well, I have to be there, make all these commitments. No, come in for an hour or two. Spending a day with the seniors, spending an hour, get to dance with them, eat with them, get to know them. Sometimes they just need someone to talk to. And that hour, that you spend taking a PTO day could be very rewarding for our seniors. Come in one day and help us prepare a food package for a family in need. Or if you want to come in as a corporate and a company wants to come in and do a project together, we're always welcoming partners to come in. Get in the nonprofit sector. It's very rewarding and you'll have an amazing experience coming to our center.
Excellent. Victoria Montero, Hispanic Center Lehigh Valley. Thank you so much.
Thank you.